And thanks for coming. The opioid crisis continues to affect everyone in Philadelphia, where every day we hear tragic stories of lives lost and families devastated. We had over 1,200 deaths from drug overdose last year, the vast majority which involved opioids. While there are many paths to drug addiction, most people who use heroin and fentanyl started with prescription painkillers, and nearly all of them got them first from a doctor. In many cases, people's first exposure to prescription opioids is after surgery. Maybe it's after a knee surgery, maybe it's after a C-section. No matter what the surgery, many studies have shown that patients use only a small fraction of the opioids that are prescribed to them. Some don't use any. Surgeons around the country are prescribing opioids when they don't need to do so, and even when opioids are needed, they're prescribing too many. I know I've told this story before, but I'll share it again. I had gallbladder surgery about a year, almost 2 years ago, and left the hospital with 30 oxycodone. And asked, why do I need 30 oxycodone? So I wound up taking 2 or 3 of them and then went to Tylenol 800, and it did the job. So what happens then is that you don't know what to do with the pills, so you leave them in the medicine cabinet, and my kids are obviously older now, so I don't have, and they don't live with me, so I don't have that problem, but that's where kids first encounter the opportunity to take those drugs from their parents' medicine cabinet. We're here today to announce a new tool to help reduce the overprescribing of opioids here in the city. Our Department of Public Health has been working with the surgeons from our largest health systems in Philadelphia, and today we are releasing a set of guidelines for safe prescribing of opioids after surgery. With opioid prescribing still at historically high levels in Philadelphia, I want to thank the surgeons sitting behind me for helping develop these guidelines. These surgeons are Dr. Scott Cohen, Associate Professor, Vice Chair for Quality at Thomas Jefferson University, Dr. Matthew Philp, Associate Professor of Clinical Surgery at Temple University Health System, and Dr. Samir Mehta, Chief of the Division of Orthopedic Trauma and Associate Professor of Orthopedic Surgery at Penn Medicine. I want to thank the 3 of them for their experience, expertise, and their leadership and the care they provide to many people here in Philadelphia. Now, these guidelines are voluntary. That means they will only help if surgeons in the city follow them. So today I'm asking all surgeons in the city to please read these guidelines and use them in their practices. It's not an exaggeration to say that the future of our city depends a large part on them. In October, we established an emergency response to battle the opioid epidemic. It's an effort we're calling Philadelphia Resilience Project. And for at least 3 months, it's been all hands on deck by 35 city agencies, residents, community leaders, businesses, and countless other stakeholders who are working with us to implement new solutions to fight this crisis, and all the challenges stemming from it: homelessness, neighborhood blight, crime, and all the other mess. We're already making significant progress, but one thing we know for sure is that the city cannot do it alone. We need to tackle this crisis from all angles, and I thank the medical community for working with us on this. I also want to thank our Health Commissioner, Dr. Farley, and his team for their willingness to always take on our city's biggest challenges head on. Now I'll turn this over to Dr. Farley, and we're making progress in Kensington, we're making progress in Fairhill, and it's a struggle, and it's an unnecessary struggle because all of this is self-inflicted because of what's going on in the pharmacy industry, in the medical profession, and in our streets every day. So let's all work together to try to make this a better 2019. So thanks, Dr. Farley.
Thank you, and good morning. The mayor gave you one measure of the severity of the opioid crisis in Philadelphia. I want to give you another one. For the first time in decades, life expectancy in Philadelphia and nationally is now going down. So for the first time in decades, our health is going backwards, going in the wrong direction. And the greatest reason for that is the opioid crisis. How could that be? I want to give you a sense for the magnitude of the prescribing and the use of opioids that's taking place. The health department did a survey last year and found that 1 in 7 adults in the city, or 13%, or that translates to about 168,000 people, were taking opioids at the time of the survey, and 1 in 3, or more than 450,000 people, had received a prescription in the previous 12 months. So we have been working hard with physicians and health plans and health systems to reduce that overprescribing. Among the other things we did, we have mailed guidelines for opioid prescribing to 16,000 physicians in the greater Philadelphia area. We delivered them in person to 1,300 physicians in their offices. And the health plans and health systems in the city have put in place policies to discourage unnecessary prescribing. And with that, prescribing of opioids in Philadelphia has fallen by nearly 25% over an 18-month period. But still, even with that, prescribing in Philadelphia is at historically high levels, far above what it was in the 1990s. And so with that, we decided to look at surgery because we were getting stories still of people like the mayor having fairly minor procedures and getting 15 days or more of opioids prescribed afterwards. We looked at data and found that the median number of pills being prescribed of opioids after surgery was nearly 40. Now, these are pills that are used every 4 hours or every 6 hours. So that translates to the median being 6 to 10 days of opioids after surgery. Median means that half of those are more than that. And to put that in perspective, CDC published a study recently that showed that among patients who are new to opioids, who haven't had them before, if they get a prescription initially for 10 days, that a year later, 20% of them are still taking opioids, and 3 years later, 12% are still taking opioids. So that's a measure for dependence. So this is clearly a gateway to dependence. 10 days worth is too much. 10 days is enough to start an awful lot of people on a very dangerous track. And it's clear that patients don't need all those pills. You heard the mayor's story. There are many studies that are very consistent now that show that on average, patients only take about a third of the opioids prescribed to them after surgery. And according to the study, between 20% and 75% don't take any. And many of them don't see any need whatsoever for these pills. There's also studies that show that if surgeons prescribe less than they're prescribing now, the patients take even less. So to a certain extent, the cue for how much people should take is given by how many pills are in that bottle that is initially prescribed for them. So we know we're prescribing too many, but there's also evidence that opioids may not be necessary at all. In fact, opioids really aren't all that good for acute pain after surgery. A review across a variety of studies concluded that a combination of ibuprofen, which is Motrin, and acetaminophen, which is Tylenol, both available over the counter, that combination is actually better than oxycodone for post-surgical pain. So we brought all this evidence to the group of surgeons that you're seeing here, and they represent the 3 large health systems, and we developed guidelines based on evidence for how many pills patients actually take after surgery as a measure for how much pain they're actually experiencing. The guidelines divide surgical procedures into 2 types. They're minor procedures and major procedures. The minor procedures you can think of as mainly the sort of procedures that would typically be done on an outpatient basis. Maybe it's a knee arthroscopy, or maybe it's a abdominal surgery with just a scope. One of the key parts of these guidelines, something for people easy to remember, is that they recommend for minor procedures 0 opioids. None, not necessary. There are other ways to deal with pain that are far safer. For major procedures, which may be more extensive, say an open spine surgery, they recommend a range of pills that are left up to the judgment of the surgeon, anywhere from 0 up to 18 pills. Now the guidelines are here, like this. They come also with a background document for the surgeons that describe all the thinking behind that so that everybody can understand why we're coming up with these guidelines. They also come with a brochure for patients so that there are clear expectations for patients on what they're going to have in surgery and why. Now, I want to be clear one thing. With these guidelines, patients will not be suffering unnecessarily with pain. In surgery, patients are going to get the same anesthesia that they've had before. And after surgery, patients will get pain medications that are far safer. Now, these guidelines are for surgeons that we are recommending for surgeons all across Philadelphia. There are other guidelines that have been developed by groups for surgeons as well. What's different about these? First, these guidelines are the first ones that we have seen that are informed by scientific evidence, that are based on evidence of what patients actually need after surgery. And because of that, these guidelines are also the strongest. These are the ones that will be most protective of patients. To put that in perspective, if all the surgeons in Philadelphia use these guidelines, This will reduce the use of opioids after surgery by more than 80%. So that will mean that if all surgeons follow these guidelines in Philadelphia, substantially fewer people will become dependent on opioids after surgery. Now, as the mayor said, these guidelines are voluntary. Surgeons can choose to use them, and they can use their judgment. I can tell you that surgeons here, in their health systems, even before we developed the guidelines, were putting in place practices and policies to reduce their opioid use. And some of them have put these specific guidelines in place already, and the patients are doing just fine. But we all need to encourage all of our surgeons in the city to follow these guidelines. So for those of you here in the press, you can help by simply publicizing them and making sure that all the surgeons are aware of them. This is new for the health department to be issuing guidelines to surgeons. But also for patients. If you are getting surgery, ask your surgeon, are you following the Philadelphia guidelines for opioids? If the answer is yes, then you're likely to be far safer after surgery than you might have otherwise been. We are going to post these guidelines on our website. We're going to mail them to every surgeon in the city of Philadelphia, and we're going to be talking to surgical groups to encourage them to follow the guidelines. Now, in a minute, I want to turn it over to Dr. Scott Cowan, who's one of the surgeons who developed these guidelines with us. But before that, I want to just take a moment to thank all the three surgeons who were involved, Dr. Mehta, Dr. Cowan, and Dr. Philp. They put in their time, but more than that, they put in their thoughtfulness. There's a huge amount of expertise and knowledge of what really happens in surgery represented by the folks here. They really thought through this, and they recognized that there have been existing pressures to prescribe more opioids, and they were willing to think through what really is necessary and stand behind these. So because of their work, many patients in Philadelphia are going to do far better than they would otherwise. So I want to thank them very much, and I want to turn it over to Dr. Cowan, and after he speaks, we'll all be available for your questions.
Good morning. I'd like to begin by thanking Mayor Kenny and Commissioner Farley for their strong support and their dedication to this very important project. I'd also like to recognize Dr. Samir Mehta from the University of Pennsylvania and Dr. Matt Philp from Temple University, who played large roles in the development of these guidelines. As physicians, we're committed to improving the overall health and safety of all members of the Philadelphia community. These specific guidelines give surgeons a much-needed, modern, and evidence-based framework for prescribing opioids in the perioperative period. For many years, the postoperative prescription of opioids was not recognized as a potential cause of opioid addiction. Several studies, including those performed at Thomas Jefferson University Hospital, demonstrate that opioids were often overprescribed after surgical procedures and that there's a need for procedure-specific opioid prescribing guidelines with an emphasis on the use of non-opioid medications for addressing pain. Our new guidelines achieve this. Despite the availability of these guidelines, surgeons will still need to make important decisions about the number of pills to prescribe. The guidelines encourage the use of non-opioid medications, including NSAIDs and acetaminophen, that have been proven to be as, if not more effective in controlling postoperative pain when compared to opioids. We recognize that physician prescribing practices must change, and these guidelines will provide a nice framework for these changes. We believe that this initiative will have a significant impact on decreasing the amount of opioids in circulation, and therefore will play a significant role in helping to address the opioid epidemic. We look forward to continuing our work with our colleagues at other academic medical centers in the region, the mayor, the commissioner, and their staff. Thank you.
All right, we are available for any questions anyone has. Yes?
I understand that doctors like autonomy a lot. What would you say to people that say this is
Yeah, the question is, doctors like autonomy, and what would you say if people said this is taking that autonomy away from them, if I put words in your mouth? These guidelines are voluntary. Doctors don't have to follow them if they don't want to, but all the doctors I know want to do well by their patients. For a long time, they've been encouraged to write more opioids and told that they're safe. We now know that's really not true, and so this gives guidance for how they can use them safely. So I expect maybe not everybody's going to follow these guidelines, but the large majority of surgeons looking at these will say, yes, these make sense, and we'll use them. Yes?
Drug manufacturers typically give doctors guidelines as well, and do
I have not seen recommendations for specific numbers of pills or numbers of days but from opioid manufacturers. I know that they have been encouraging doctors to prescribe more and prescribe them for more situations, more indications, but I haven't seen specific numbers. But this is going to be pushing doctors in a different direction from the way that the pharmaceutical manufacturers have been pushing them in the past. Yes? I'm a doctor, not a lawyer. I can't answer that question. I can simply say that they are far safer, and we would encourage surgeons to follow them.
Last week, when the pharmacy outlet bill got held, briefly said that the administration had requested it, but then backed away in the face of lobbying. What's your take on that?
I think the chamber did step in and had expressed some concerns. And we're working with them to try to improve the bill to make it better. There was issue relative to the potential loss of business from the convention center on bio and pharma. So we wanted to have some conversation about that.
So did you back away?
Not from the overall premise, but there's other issues that we need to balance. And we need people to still work in our hotels and work in the convention center, and we want to make sure we weren't going down a path that was going to cause us lost opportunities for people to work. So we're not backing away. Obviously, we're doing this today, and we're working best we can to deal with the bill. I'm not aware. I have to talk to the city solicitor to find out what the progress is, but I just saw in 60 Minutes this past weekend the lawyers who were dealing with the tobacco industry and had won that case were involved in the Ohio case. They misled, in my opinion, misled people and misled doctors into thinking that this stuff was not addictive. If you just go to Kensington and Fairhill anytime today, you will see that they were dead wrong and should be responsible for providing resources to get people the medical treatment and addiction treatment that they need.
Do you have a question? Yes.
What was the involvement of the insurance companies and the issuers in this guideline, and what were their reactions?
We have not developed, we're not involved in the health plans in developing these guidelines. We have worked with the health plans to put in place what we call prior authorization standards, so that if a doctor writes a prescription above a certain threshold, he's going to be told that prescription won't be reimbursed unless he can provide a justification to the health plan. So that exists already, that's in the background, but this was something that was developed by surgeons, really to be very specific about what surgeons ought to do.
How do you expect them to react to something like this? They are very reimbursing for patients.
I frankly don't think that this will change what the health plans do at all. I think this is something it's going to change what doctors write for, and the prescribing that they're writing for now is still being paid for by health plans. I don't think that'll change, but you will see our sharp reduction in prescribing. Okay, that's it. Thank you all very much. Can we get one quick picture before?
We'll do this around here.
Yeah. I don't know exactly where to stand, but come on over here. We want to get one shot of everybody standing with the mayor.
That's where we want to go.
All right. Thanks a lot, Mayor. Thanks, guys. That was great. Thank you.
Scott, very nice.